Hi, I'm Dr. Adrian of Palmyra, Pennsylvania, the leading and longest practicing integrative and alternative medical doctor in central Pennsylvania, with training in both family medicine and complementary and alternative medicine. Integrative medicine is the combining of the best of conventional medicine with safe and effective alternatives. It takes a trained medical professional to do this properly. As a general practitioner, I can treat the whole family. I am known for my holistic approach to my patients. I spend significant time with them getting to know their whole story, including medical history, prior conventional and alternative treatments used, diet, lifestyle, and physical and emotional stressors. I carefully adjust or stop their medications if needed and add safe and effective alternative treatments to help restore them to a state of wellness that many never experienced in their youth. The tools that I have in my toolbox will not be found at your conventional medical doctor's office. If you found my website, it means you have joined the many people who are looking for a doctor who has something to offer that is not found in the mainstream medical system. My interest in natural or alternative medicine began when I was just a child, largely influenced by a mother who was ahead of her time. When serious illness hit my family when I was young, I witnessed firsthand the limitations of the, quote, standard of care, when my loved one suffered serious side effects of chronic medications that did nothing to make him well. It was only through the help of an alternative doctor that we were guided to help free him from the drug-induced chronic degenerative disease that the medicines themselves amplified. I have had my own personal struggles with my health that have taught me much about sickness and healing that just cannot be learned from a book. Before I went to medical school, I had already read and learned a great deal about the natural approach to help heal the body and had at my fingertips books to read alongside my standard medical texts. I read books about naturopathy, diet and nutrition, Ayurvedic medicine, homeopathy, herbology, orthomolecular medicine, and holistic medicine, and more. Such teachings are ignored by standard medical training, and I wanted to be sure that I learned this as well so that I could incorporate this into my understanding of disease pathology and the best approach to reverse it. After my years of medical training, it became apparent to me that physician training is dictated by the financial interests that control the health care establishment and medical education. Mainstream medical practices and treatments, for the most part, must be profitable. And if a treatment can be provided without a medical degree, or if a pill does not require a prescription, it must be ineffective. If it is not taught in medical school, it is of no value. This inaccurate ideology is instilled into graduates of medical schools and prevents them from being open to any other healing paradigm. Unfortunately, the field of alternative medicine is filled with profit-seeking charlatans and businessmen who are trying to capitalize on the growing distrust towards conventional medicine and the tremendous consumer interest in nutritional supplements and cure-all products. I have been studying and buying and selling nutritional supplements and health foods since my college days. I learned that there are quality and poor quality supplements on the market. Many are scams. Many are low quality, hyped up, overpriced products that feed pyramid schemes. But more importantly, I learned that one can literally poison themselves with some nutritional supplements by following the recommendations of the manufacturer and many best-selling books. I have seen this often in my patients. I have explored the supplement industry for decades now and have assembled a formulary that I believe contains the highest quality and purest on the market, and I have much experience in observing their effect. The body requires balance. More is not better, and many products contain substances and fillers that are best avoided. Another current trend is for alternative health practitioners to replace a good history, physical exam, discernment, and sound advice with the illusion of health care. By this, I mean the patient is given unnecessary or fad laboratory testing that puts on a good show for the consumer and makes money for both the doctor and the lab, but ultimately makes no difference in the patient's health or their presenting complaints. I do not order unnecessary tests to put on a show for my patients. I have pursued many tests and treatments over the past 20 years and continue to offer only that which was found consistently to be of value. My goal is to quickly provide life-changing answers and treatments. I have distilled my armamentarium down to what is most effective. I will evaluate and advise regarding any test or suggestion that my patients present to me. I refer patients without hesitation when they need the services of other subspecialties, chiropractors, masseuses, or other testing. But I do protect my patients from harmful treatments, drugs, or tests, especially when they are not truly necessary. I stop medications that I believe are causing harm and often replace them with safer alternatives. Typically, doctors are afraid to stop another doctor's medications, and the patient's list of medications just keeps growing. Since the 1990s, I have had a special interest in helping women balance and restore their hormone balance. This has been very successful, and I have women both young and older who travel hours to see me for my consistently effective program, which includes compounded hormone medications made by me in my office. This assures consistency on the medications or of the medication's effect. After witnessing the many health benefits of patients who had received EDTA chelation therapy, which removes heavy metals, I began doing this and other IV therapies in 1998. At that time, I completed the chelation training offered by the American College for the Advancement of Medicine, which is acam.org. I have conversed with Dr. Elmer Cranton himself numerous times in my research of chelation therapy. I have started and ran literally thousands of IVs since 1998 and seen countless success stories. I personally mix and start all of the IVs at my office, and you will find that there is no one better at starting an IV and with the least discomfort. I also offer intravenous vitamin C, IV glutathione, and IV vitamin therapies, including the Myers cocktail. Since 1998, I have tried and abandoned a number of highly promoted IV therapies that I did not see any obvious benefit from. I am not new to alternative medicine. I am one of the first medical doctors in central Pennsylvania who dared to think for himself and venture from the fold in which I was trained. Medicine is a huge field, and no one doctor can do it all. But it is a good idea to have an integrative primary care medical doctor to be your quarterback in navigating your journey through the conventional medical health care system. My goal in our patient-physician relationship is to listen to you, my patient, and to be your partner in helping you to heal yourself.